Welcome to this quick guide on precision medicine, targeted therapies.
A targeted therapy drug is a cancer treatment that targets a specific cancer subtype. They are only likely to work in those specific subtypes. Cancer subtypes can be identified by the presence or absence of a biomarker. A biomarker is a sign of disease or abnormal function. Doctors use biomarker information to help match targeted therapy drugs to your specific cancer subtype.
Chemotherapy and targeted therapy drugs work in different ways. Chemotherapy destroys all fast-growing cells, regardless of whether the cells are part of your cancer or not. This means normal, healthy cells may also be destroyed. Targeted therapy drugs keep cancer from growing and spreading with less harm to cells that are not cancer. They may have different side effects than other treatments because they're better able to target your cancer cells and leave healthy cells alone.
Your genes, sometimes called your DNA, are molecules that control how your body makes other molecules called proteins.
The targets that targeted therapies work against are also called biomarkers. A biomarker is a sign of a disease or abnormal function. Biomarkers can be proteins, genes, or gene mutations. To learn more about biomarkers, watch our quick guide on precision medicine, biomarker testing, see our precision medicine booklet, or visit our precision medicine web pages.
There are different types of targeted therapies. They tend to be either small molecules or monoclonal antibodies.
Small molecule targeted therapies can be taken by swallowing a pill. They act on targets that are inside of cancer cells.
Monoclonal antibody targeted therapies are injected into a vein. They act on targets on the outside of cancer cells.
There are many ways that targeted therapies work against cancer. These include finding and tagging cancer cells. When monoclonal antibodies stick to the surface of your cancer cells, they act as tags. This makes it easier for your own immune system to find and destroy those cells. A second way that targeted therapies work against cancer is finding and destroying cancer cells directly. Both small molecules and certain types of monoclonal antibodies can stick to targets in or on the surface of your cancer cells and then kill those cancer cells directly. A third way that targeted therapies work against cancer is by cutting off the blood supply that tumors need to survive.
Some targeted therapies stop tumor growth by cutting off the blood supply to the tumor. Blood vessel growth is also called angiogenesis.
A fourth way that targeted therapies work against cancer is by cutting off the hormone supply that some tumors use to grow and survive. For these types of cancers, targeted small molecule therapies can stop tumor growth by stopping your body from making or using the hormones that your tumor needs to survive. A final way that targeted therapies work against cancer is by taking the brakes off the immune system. To keep your immune system from attacking your healthy cells, your body has safeguards in place. These are called checkpoints.
Some cancers are able to control checkpoints. This allows the cancer to avoid being killed by the immune system. Targeted therapies aim to remove these checkpoints. Some targeted therapies take the brakes off your immune system to help your body fight cancer. To learn more about these types of therapies, see our course on immunotherapy.
Even if your tumor has a molecule that matches up with a targeted therapy, it doesn't mean that the therapy will work on your cancer. Or the therapy may work for a while and then stop working. One reason for this is that cancer cells are far more likely to change or mutate than normal cells. This means that the target can change.
Or another reason why targeted therapy may not work is that the cancer has figured out a way to grow without using the molecule that the therapy is blocking.
Sometimes targeted therapies work best when they're given in combination with other targeted therapies or with chemotherapy.
Sometimes, when a patient experiences a side effect from a targeted therapy, it means that the therapy is working. For example, lung cancer patients who develop a skin rash while taking therapies that target EGFR are more likely to respond to the treatment than patients who do not develop a skin rash. This is because EGFR is a molecule that is found in large amounts in non-small cell lung cancer cells, but is also found in very small amounts in normal skin cells. That's why a skin rash is a sign that EGFR-targeted therapies are hitting their target effectively. Not all cancer patients will be treated with a targeted therapy. However, many patients are benefiting from the new treatment options provided by targeted therapies. Talk with your doctor about your cancer treatment options and ask if there are any targeted therapies that could work for you.
To learn more about precision medicine and targeted therapies, see Cancer Support Community's Frankly Speaking About Cancer Precision Medicine booklet and visit Cancer Support Community's Precision Medicine webpages.